John's Retirement Journey and Travel. Welcome to another meeting of the Retiring Club. We're going to continue on with our series, Retirement Today. In the first video of Retirement Today, we talked about income replacement. We had a scenario of a web page designer, AWS or database professional arriving at the office, turning in equipment and badge and being sent home. You have the shock, emotion, worry, fear, and now you want to wait for the Teams or Zoom meeting to find out your fate. This is where a good retirement plan can be implemented for early job loss. You could turn this event to our advantage. In this case, you could take a sabbatical. You can go home and visit your family wherever. You can promote yourself into retirement, pursue other interests, look for another job or business, and suspend the whole thing and move forward. So I'm going to go ahead and continue on, and we're going to start talking about some other items that you may have to have on your radar map. My name is John, and you're with me at the Retiring Club.
All right, folks. So let's go ahead and take a look at the tax bracket. So once you go into your retirement or you lose your job, you're going to slide out of one of these tax brackets unless you go back to work right away. So we got that 10% tax bracket at 0 to 12,400, the 12,401 to 50,000. This is where I'm at right now in my retirement. When I was working, my salary was $200 a day. So that put me in the 22% tax bracket. And then it goes up to 32, 35 to 37. Now, the reason why I'm bringing this up, when you go in to your early retirement or you're in between jobs and you start accessing some of this money, you want to try and see where you're at within these tax brackets so that you know how much you need to pay if you do an IRA distributions or something like that. Now, for the married filing jointly, you've got these other different tax brackets here. The biggest thing that's going to make a difference is the standard deduction. This is where I'm at. I'm at 16,100, and the married filing jointly, this is 32,200. Now, a lot of the folks who have retired early, and I'll use Steve over at Steve's Retirement Corner, his budget is about 3,000. I think he takes out a little bit more, but and that would come off on his 104011 as some type of IRA distribution and with his adjusted gross income of 11. But he will get a deduction here of 32,200 in the next section when they start taking, they either do the credits or the deductions. So he would only pay taxes on a smaller amount. So if you are retiring early and you're married, you got that home paid off, your cars are paid off, and you can live off of 32,200, you're in really good shape, because the money you pull out as a taxable income, you could slide under the standard deduction. You got the head of household, 24,150. That would be like for a single parent. And that's about it. So you want to get familiar with these tax brackets as well as the standard deduction. You could just put them somewhere and keep an eye on them when you're withdrawing your money. So let's go into healthcare. Once you separate from your employer, they usually go ahead and offer you COBRA. Now, from what I understand and what I experienced, there's 60 days that 30 days you make a choice, and there's 60 days to get it in, and then you make a premium payment. After that, they won't accept it, I believe. But COBRA is very expensive, and you got to ask, do I need it? And can I afford it? For some of the high net worth individuals who may have a partner that's going through some health related issues, or it's mandatory that you have him or her under some kind of coverage and you can afford it, you go ahead, they go ahead and get it. I think Scott over at Ramley, Retirement Ramleys, I think he went with the Cobra. And I know that David over at David in Progress went with the Cobra. And he had some medical issues that were required him to be under care of a cardiologist. And that allowed him to go see all his doctors and make sure it's paid. But when you have these guys that are retiring at 54 and 55 years of age, they typically have a lot of money. You know, they're 1.2, 1.5, couple $1 million, and they can afford to pay this. It's a little easier to just go ahead and pay the Cobra when you have a chronic illness like that than trying to go out and hide all your income and you know getting on ACA or the Christian health, because a lot of times they will consider that a pre-existing condition. That's why some people take Cobra from the research that I've seen studying other people. Um, then you have your spouse or your partner insurance if available. If you're in a relationship and your partner or your wife is still working, they can just simply put you on their insurance. There's a lot of people who are relatively healthy, even with kids. They go without health coverage and they pay as you go. They negotiate a price that's agreeable between the doctor's office and the other healthcare agencies, and they just go ahead and pay out of pocket. And that's same for the dental. I think my dental, the young lady said it would be 160 per visit, which would have been 320 a year for my two dental visits. I just added $200 and I got the same MetLife take along for seniors because if something came up, root canal, chipped tooth, uh, I needed another crown for something happened, you know, I would be covered. And I don't have to worry about that waiting period. On the low income, you've got the county health department. They have doctors and nurses on duty, you know, that can help you with some basic stuff. Then you got your urgent care for any needs like you got inflammation. I frequently have upper respiratory infections, scrapes and bruises, broken bones. Um, I'm not sure how much they charge for their X-rays and any other stuff that they may do other than the exam, but it's usually about 150 bucks to go in there is what you have to pay out of pocket. Then you've got the Christian and the farm bureaus. I think Joe Kuhn uses Indiana Farm Bureau. And I checked here in Georgia, they do have that available, but it is for self employed people. So if I was self employed, I could go under the Farm Bureau network for that. And then here you got the Affordable Care Act. And this is where you want to get in and keep your income low. Um, you've got Medicare, Medicaid, if you qualify, that's on the low end. And then you got Medicare if you're 65. So right now, um, I'm using accident and critical illness with UMA that covers strokes, cancer, heart attacks, and any kind of a limb issue. So I've had that policy for a really long time. And what would happen is if any of those happen, I have to fill out a form and there's a set amount of money that they will pay. So I have that. And what I've done is I went with no insurance for 1 month in the month of October. So I would have used a urgent care, and I'm on Obamacare now. Now with the Obamacare, I'm going to show you this link down here, this independent source. If you were interested in what your cost would be, if you go to this link, you just fill out all the criteria, and it would tell you whether or not you have a good chance of not having a premium or how much it would be for your bronze or your silver based on your income. My income of 24,000 a year is keeping me within the full subsidy so far. So that is basically it on this presentation. What we're looking to do is get educated on how to fill the gaps in any early retirement. Now, I had just finished watching a 48-minute presentation on YouTube presented by Fidelity. Everything in it. Fidelity also has certified financial planners that will help you develop a free plan. Fidelity slash free plan will help you start developing your retirement plan and structuring so that if you get let go, just say, hey, I was listening to some of the YouTubes. I looked at your video. We have an account. I like to set up a meeting. If you can do and get yourself structured when things are going really well, when you get that tap on the shoulder or that door is slammed on you, you can just simply switch over and you'll know exactly what to do. My preparation allowed me to go into retirement and I'm able to withdraw from the pre-tax account enough not to have to pay taxes. And with the correct positioning of your investments, it will actually grow as well as generate enough cash income at the end of the year when they pay out the dividends, short term and long term, to help cover you if you don't have too much expenses. If you have $5,000 expenses, that's a different ball game. But those of us like Pete over at Retire Early with Me, his budget is 750 a month, and then he just draws cash out whenever he needs. With a budget like that, he can go for 15 years, and all he has to do is have $300,000 in tax-free money or money that's showing up from his IRA as a taxable income or an IRA distribution. And every year he can have a CD mature and he just puts it in his account that satisfies the ACA. Because I was watching Retire Early with Melody and Keith, and Keith was mentioning that how he needed to generate some more um, adjusted gross income to keep from being bumped off of ACA. They want to you're too low, so they wanted to send him to the Medicaid type of arrangement, and they're already set up with their doctors. So there's a lot. I just thought I'd come on and try and spur you to start taking a look at some of this stuff. At least meet with a financial planner while things are going well, so you can make the adjustments, you know, and get ready to have a plan of action in case you get the tap on the shoulder to retire early. Okay. So my name is John, and you're with me here at the Retiring Club. And we just covered some taxes, standard deductions, and what our healthcare options are here in early retirement. Okay. And thanks for watching. I hope you subscribe and stick around for the next one. I've got plenty more coming. Thank you.